Hello everyone, I'm Nick, a college student who is learning psychology course. Today we are going to talk about obsessive-compulsive disorder. Here is the outline of this video. So what is obsessive-compulsive disorder? To draw a definition, obsessive-compulsive disorder is an anxiety disorder in which people have recurring, unwanted thoughts, ideas, or sensations that make them feel driven to do something repetitively. Well, a medical term that seems to be a little bit complicated, right? It's okay. Let's take apart this terminology to see if that could help you understand well. OCD has two parts. One is obsessive part. Basically, obsessions are some recurrent and persisting thoughts, impulses, or images that cause distressing emotions such as anxiety or disgust. Well, these thoughts are excessive or unreasonable. For instance, contaminations or harm, the need for symmetry or exactness, or forbidden sexual or religious thoughts. In simplest terms, obsessions is about mental force or drive. Well, most of OCD sufferers has obsessive thoughts with no logic or reason. They try to ignore the thoughts or offset them with other thoughts or action. So you have a fundamental concept about obsession. Now we are going to talk about the other part, compulsions. If we said that obsessions are thoughts, we could say that compulsions are actions. Compulsions are repetitive behaviors or sometimes mental acts that a person feels driven to perform in response to an obsession. Well, the facts are the same as obsession does. These compulsive behaviors are aimed at preventing or reducing distress or a feared situation, but they are irrational. For some severe cases, OCD sufferers would do some actions all day long, which seriously affects their daily life. Here is a picture that might well explain the cycle of OCD. A sufferer first starts with a pre-existing obsessive thought, like something is dirty, I must clean it. Then the obsessive thoughts produce anxiety emotion to the sufferer. In response to the thoughts and deal with the anxiety the thoughts generated, the sufferer starts to have a compulsive behavior to release the anxiety. It's temporary. So the cycle is created, and it could explain how repetitive behaviors come into being. As previously talked, many people have some obsessive thoughts or repeated behaviors. Do they have OCD? No, they don't. For people with OCD, thoughts are persistent and unwanted routines and behaviors are rigid and not doing them causes great distress. A diagnosis of OCD requires the presence of obsession and compulsions that are time-consuming. For instance, more than 1 hour per day, which may cause major distress and impair work, social, or other important function. The causes of OCD are generally two sides. In biology side, some specific heritable genes have yet to be identified. In environment side, some facts like infections might be suggested as a trigger. Here are some risk factors that might increase the risk of developing or triggering OCD. Family. Parents or other family members with the disorder can increase the risk of developing OCD. Stressful events. If someone experiences traumatic or stressful events, the risk increases. Besides, other mental health disorders like anxiety disorder, depression, and substance abuse, and so on may increase the risk of developing OCD. For OCD sufferers, they might have some health issues, such as contact dermatitis from frequent hand washing, inability to attend work, social or school activities, troubled relationships, overall poor quality of life, and suicidal thoughts and behavior. For most psychological disorder sufferers, usually it's hard to perfectly cure them. OCD sufferers are not out of this cycle. Here are some therapies and meditations the doctor recommended to have an effective treatment for OCD sufferers. Cognitive behavioral therapy is known as exposure and response prevention. During treatment sessions, patients are exposed to the situations that create anxiety and provoke compulsive behaviors or mental rituals. This technique works well for patients whose compulsions focus on situations that can be recreated easily. Cognitive behavior therapy can help many OCD patients substantially reduce their OCD symptoms. And a classic of meditations known as selective serotonin reuptake inhibitors is effective in the treatment of OCD. Patients with OCD who have received appropriate treatment has shown to increase the quality of life and improve functioning. Successful treatment may improve the individual's ability to attend school, work, develop and enjoy relationships and other activities. And last, ordinary people might sometimes have obsessions or compulsions. How to deal with it? Here are some tips for self-helping. Learn how to resist OCD rituals. Don't avoid your fears. Like cognitive behavioral therapy, you shall not avoid your fears. The more you avoid, the scarier you feel. Try to expose yourself to your triggers. Anticipate OCD urges. By anticipating your compulsive urges before they arise, you can help to ease them. Create a solid mental picture, then make a mental note. Like the window is not closed, I can see that oven is turned off. Refocus your attention. When you are experiencing obsessive thoughts, you can try to shift your attention to somewhere else. It may help. The important thing is to do something you enjoy for at least 15 minutes in order to delay your response to the obsessive thoughts or compulsions. However, if obsessive or compulsions seriously influence your personal life, I recommend that you accept professional treatments from doctors or psychotherapists. Here are all contents that I shall cover in this video. Hope it helps you understand well the concept of OCD. If you have any questions, comment under the video. I'm willing to answer your questions. Here are references in this video. Thanks for your watching.